Hello, and a very warm welcome to episode 3 of our Health Talks podcast. My name is Sam Armstrong. I'm the Director of Corporate Affairs at Kingston Hospital and also at Hounslow and Richmond Community Healthcare. Our Health Talk podcast is for members of Kingston Hospital Foundation Trust and is also for our local community. If you would like to become a member of Kingston Hospital, please visit our website, kingstonhospital.nhs.uk/get involved. It's a great way to support the hospital, stay up to date with our latest initiatives and be involved in our plans. Today's discussion will focus on the topic of diabetes, and I'm delighted to be joined today by Claire Neely, diabetes nurse consultant and joint clinical lead here at Kingston Hospital, and Michelle Hooper, diabetes dietitian and clinical services manager at Hounslow and Richmond Community Healthcare. Claire, perhaps to begin with, could you tell us just the difference basically between type 1 and type 2 diabetes?
So thank you, Sam, for inviting me to come and talk about diabetes. Yes, so type 1 diabetes happens when you can't make insulin at all, and it is a condition which cannot be avoided. It occurs in only 10% of the diabetes population, with the majority having type 2 diabetes. Type 2 diabetes is a bit different. Generally, there are two causes, something called insulin resistance, where your insulin isn't working effectively. Often this is where it is linked to lifestyle and diet, and it generally develops over time. You are also not producing enough insulin, being the second cause, so often this is where that needs to be supported. Both types of diabetes have the same symptoms, but often with type 1 diabetes, these occur quickly and suddenly, whereas type 2 diabetes, these are generally, as I said, develop over time, so more onset is slower.
I always remember, and I think this is very different now, I thought when you got type 2 diabetes, you had that forever. It seems now that there's more instances of people being able to reverse it. Michelle, are you able to maybe elaborate a little bit on that?
Yeah, I think it's so positive that it's one of those really positive things, and that, you know, being a dietitian, we're always very fixed on what we could say, obviously because of our, you know, evidence-based practice. But there's so much more out there now, and so much more, you know, positive message to say, you know, that if we can lose weight. Some very good studies over the last few years have shown that the significant weight loss around the middle for type 2 diabetes, around our middle, where our organs are, can really help the organs involved in diabetes to work better. And, you know, we do often see people coming off their medicines if they've only had diabetes for a few years. It just takes that sort of diet lifestyle change, and absolutely, whereas before we used to say, oh, it's a progressive condition, and there you go. But there's a positive message now, and it's great, really.
It really is fantastic, these advancements that we've made and able to help people, because it might be worth just stating, I think, for, you know, what are the real dangers of type 2 diabetes? How is that going to affect someone's life, and what are the worst things that can happen?
So I think long-term high blood sugar levels will cause damage almost head to toe. So you're looking at for your heart and heart disease and stroke being the two sort of major complications, but damage to the eyes, to the kidneys, to the feet, and to the nerves, and circulatory problems, because you've got all the sugar running around in your blood. It's really going to be affecting the circulation. So anything involved in the circulation gets damaged. But it's this sort of trying to get people to understand that it's this long-term high blood glucose levels, and if the person can keep things in check, then they needn't really happen.
Can you tell me a bit about the diabetes service at Kingston Hospital?
Yes, certainly. So at the Diabetes Day Unit here at Kingston, we provide care for both inpatients and outpatients from the surrounding boroughs. Currently, we would estimate there being 1 in 6 of our inpatient beds are occupied with someone with diabetes. So relating that to Kingston, we're probably looking at about 60 people with diabetes in the hospital at one given day at the moment. In view of that, we have an expanding inpatient team with all members of the multidisciplinary team, including a consultant, diabetes specialist nurses, a podiatrist, dietitian, and also a diabetes technician, which is quite a new role for us here at Kingston. Within the borough, there are approximately about 8,500 people diagnosed with type 2 diabetes and about 800 with type 1 diabetes. But evidence suggests that within Kingston Borough, there is also just over about 3,000 people undetected with type 2 diabetes. Our outpatient service here supports people with diabetes to self-manage their diabetes. And as a secondary care provider, our main focus is supporting those people with type 1 diabetes, those with type 2 diabetes under the age of 30, and people with complex diabetes needs. We also provide support to the maternity unit for our expectant mothers with both type 1 and type 2 diabetes, and also gestational diabetes, which is something that can develop during pregnancy. So along with our general clinics, we also provide a clinic with our paediatric colleagues for those transitioning from paediatrics to adult services. This can be quite an anxious time, both for the child and the parents. And it's a time when the young adults want to become or are striving for independence and need support through this time. So it's a very important clinic that we have here at Kingston.
Great. I must say, I'm very surprised by those numbers. I just didn't appreciate that it affected so many people at such a really high proportion of our patients. Have you seen a huge increase in recent years, or has this been a fairly steady number over the last 5 or 10 years?
Yeah, so actually, yeah, we have been starting to see an influx, and I would, over the last 5 to 10 years, definitely. And I think the figures that Diabetes UK always show on their website, and also the national audits that we do, so the national diabetes audits, also clarify this. I would say, especially over the last 2 years, and especially now, we're seeing an influx of people attending with probably a new presentation, but actually with type 2, it's probably been there for the last couple of years. But because of COVID, there's been a delay in getting them seen to give the diagnosis. So we're probably seeing them more at an acute stage than we would have done previously.
I'll echo that as well, with the lockdowns and people really not going out at all. It does seem to be more coming in. I think people's weight has gone, well, it's definitely gone up during COVID and prior to that. And there are signs and symptoms you can ignore quite easily, which is the worrying thing always about diabetes, isn't it?
I just come back in as well, because actually we're not sure whether COVID in itself has brought some strange or very unique presentations of diabetes, and that's something we're also seeing. And nationally, it's a discussion amongst diabetes sort of community as to these presentations, because they're quite unique in how they're presenting.
Yeah, I mean, I suspect we've all known about diabetes, so it's probably not the case that people are being discovered with it. We've known about it for a long time. It feels more like probably a lifestyle issue amongst people. And I will mention weight later on. I myself, during that lockdown, have put on a considerable amount, and I suspect a lot of people have. And also then the delay in coming forward with this, as it has with many issues across the NHS and diseases that COVID has caused. So how has Kingston Hospital been working with community partners to improve care for patients with diabetes?
So because Michelle will be joining us, I'm going to leave her to talk about our relationship with HRCH, but we also work very closely with our community colleagues in Kingston with Your Healthcare as well, and especially from the foot perspective, because we run an acute foot service here at Kingston that is very multidisciplinary, and we have a podiatrist that comes from Your Healthcare to support that clinic. Now, this is vital because it actually provides a very integrated approach to enabling instant links with primary and secondary care, and it's more of a fluid pathway that these people can follow in having some of their care in secondary care when required, but also then coming back closer to home in primary care as well. So that's something that I think is really vital. And I'll hand over to Michelle with our work with HRCH, because actually amongst our colleagues there, that has been again vital, especially during COVID with our inpatient and discharges.
Yeah, so the team here, we run a sort of outpatient clinic or hub here at Teddington Hospital, and another one in Parkshop Medical Centre in Richmond, so sort of serving the other end of Richmond Borough, where we have consultant and diabetes nurse clinics. We are also, the diabetes nurses support the housebound patients. So these are some of the patients coming out of Kingston or via the GPs, and we aim to support them as well.
So as very much a layman in terms of clinical matters, I've got to say I'm fascinated when you say a foot clinic. Can you tell us a little bit more about feet and diabetes? Because how does that come about? What is all that about?
Yeah, so having diabetes can put you more at risk of complications with the foot. Raised blood glucose levels can damage the sensation in your feet, which can also affect the circulation, again leading to you getting less blood supply to your feet, and this could then lead to further problems. So it's very important that we don't neglect our feet and that we do monitor and have a look at them so that we can reduce these complications. And that's what diabetes care is all about, is how can we avoid our patients from developing complications and picking up early signs.
What can a patient expect if they're diagnosed with diabetes? Claire?
Yeah, so I will focus on diagnosis of type 1 diabetes purely more because that's what we tend to see here in the acute sector of in secondary care. Diagnosing diabetes can be a complex process, and how it is diagnosed will have an impact on that individual for the rest of their lives. So it's so important that we get that right. Type 1 diabetes, as I previously said, can't be avoided. So it's so important that we do recognise or make people aware to recognise the symptoms quickly. Diabetes UK have done a big campaign around the 4 Ts. So that's thinking, and it's an easy reminder for people of what they should look out for. So they list the 4 Ts as being thirst. So if people are feeling thirsty suddenly, if toilet, so needing to go to the toilet quite a lot, especially overnight as well. Feeling tired, feeling lethargic, but the T being tired, and also thinner, so losing weight as well. So they're the 4 classic symptoms of diabetes, and it's something to try and embed to make people aware, because if we can pick it up at an early stage, we can often avoid admission to hospital. And it means that if they need admission to hospital, it's escalated quite suddenly, and it can be quite a traumatic experience. So we want to try and avoid that. And so here at Kingston, what we do is we try and see people here in the outpatients in a quiet environment, not a busy emergency department, so that it's less stressful for them and they can sort of grasp the information, because there's going to be a lot of information that we need to give them because it's a life-changing condition. So initially they'll be taught how to give insulin independently, and we'll also get them to check their blood glucose levels, again teaching them using the technology we have. Fortunately now insulin pens have been developed, and they do make this process a lot easier for people, and they're a lot simpler to use than what some people can remember of needles and syringes. And going forward, we will give them constant contact, because we want to just give them little bits of information over a period of time, so that they're not overwhelmed by the whole diagnosis.
Okay, Michelle, how does diet impact diabetes?
I always say directly, because where does the sugar in the blood come from? And it comes from our diet, and it comes from a specific food group, which is the carbohydrates. And I think it's always very surprising for my patients, especially newly diagnosed, is how wide ranging the carbohydrates are in the diet, because I think we always just think of sugar, and sugar is a carbohydrate, but so is starch, all the starchy foods, all the grains, and all your tubers, all your under the ground vegetables, your sweet potatoes and your potatoes. All of those foods, when you eat them, they digest into sugar in your blood, and that's what's got to be sort of managed by insulin. The other place where we find lots of carbohydrate, if you want, is some of the fruits. So some fruits, which are very healthy. I'm not going to say don't have fruits, but with diabetes, you want to just be a bit careful of some of the more sugary fruits like mangoes and bananas, and not have too much at one time. And I always also think that if you've got diabetes, if you're drinking a big, large latte, that's all milk, and milk has also got sugar in it, lactose. So I'm not saying that we shouldn't be having these things. It's just about portions.
I imagine in your work, if you're dealing with people who've got diabetes, are you helping them, educate them in terms of diet? And what sort of observations do you find in terms of a classic person, if we can put it that way, who has type 2 diabetes in their diet? What do you see? What do you have to change for it?
The classic is the portion control and the sort of lack of knowledge that it's not just the sugar that we need to be reducing. And I think our portions have got bigger. So the big one is the sort of misconception that perhaps the brown rice, I can eat as much as I want of it, but it's still a carbohydrate. On the other side of things, I think with type 1 diabetes, my role is to help people understand quantity of carbohydrate and adjusting the insulin doses according to which Claire was saying that, that's another big impact on their lives. We're just trying to identify carbs, count them, and adjust insulin according to them. So that's sort of the role of the dietitian for type 1 and type 2.
Michelle, would you be able to give us a couple of classic tips, maybe, that just in our general diets? I mean, you've spoken about it there, but in
Yes,
terms of what are some key things you could tell us all to go away and be mindful of, or things we could change? I mean, for instance, it sounds already like perhaps having an Americano with a little bit of milk is probably a better option than a latte. But are there some things you could just give us now?
Yeah, my three main things would be, yes, you're absolutely right about the coffee. Even a cappuccino is half milk, so there you go. That would be one. I would say with my biggest one is I always draw a picture. If you can imagine your plate, half of the plate should be vegetables, grown above the ground. A quarter should be the carbohydrate. So the portion is small. If you've got diabetes and you have a small portion of carbohydrate, then you'll just get a little rise in your blood glucose. And you should always have a source of protein with the meal. So whether you're vegetarian or not, meat, fish, eggs, lentils, soya, because that will satisfy you for longer than just having the vegetables and the carbohydrate. And I would say fruit. Spread your fruit through the day. Don't cut it out. So have lots of vegetables and spread your fruit through the day, one portion at a time. And a portion is about what you can fit into your hand. And exercise. I know that's not diet, but God, that's massively important, because your muscles use the sugar. That's the other thing I always talk about. If you want to reduce your sugar in your blood, go for a walk. And also, one of the things I always talk to people about is that if you can do that most of the time, there will be the odd time you don't, but don't feel you've failed when you've not actually achieved that half a plate of vegetables. But if you can do it 80% or 70% of the time, then you're in a really good place.
That's terrific. So we've covered some, I think, very interesting information here. I might ask Michelle, where could someone go to get further information about diabetes?
For type 2 diabetes, there are two very good websites I always recommend. One is Diabetes UK, which is a brilliant website with an incredible amount of knowledge and information on both types of diabetes, from diet to medication to every aspect. Another one is a forum, diabetes.co.uk, which I think is also very good because it's more of a forum, and you can it's more of a group, and people can post information and how they're doing, etc. The other information sort of centre that we refer people to is the Diabetes Book and Learn service, which is a sort of a digital service, but it's where we book all our structured education. But there's also about 7 or 8 other digital courses and weight management courses for people with diabetes and pre-diabetes as well. So those are my three places. Claire, I don't know if you have any more.
Yeah, so I'd very much say Diabetes UK, just because also you've got it's run by professionals as well, so we know that the facts are going to be correct. For type 1 diabetes, also the JDRF website. I would also be mindful not to explore the web too much, because actually you're going to get some incorrect information.
Recommended sites is best. I think definitely. That's terrific. I've certainly learned a lot from our conversation today, and I'm sure everyone listening has as well. I would like to thank our speakers today, Claire and Michelle, and thank you all for listening. We hope you'll be able to join us again next time for another of our Health Talks.